I would like to extend a heartfelt welcome to you all.
Hello everyone, this is Praveen from Biotech. Today I am going to talk about the three evolutionary fields in biotechnology: bioprinting, organ-on-chip technology, and biomanufacturing. These technologies are transforming the way we study disease, develop drugs, and even think about organ replacement. They represent a shift about traditional models like cell culture and animal testing to advanced surveillance systems. Let's start with a little history. In 1984, Charles All patented the first 3D printing process. At that time, it was mainly used for plastic and prototyping, but it laid the foundation for everything that came later. In 1988, Robert Clip experimented with printing living cells using a inkjet printer. Imagine how radical that idea was at that time. Using a printer to place cell precisely. This was the early spark of bioprinting. In 20s, scientists adapted microchip fabrication techniques to biology. This gave rise to organ on a chip, where a tiny device with microchannels that mimics the behavior of real humans organ. And in the last decade, something even more powerful happened. We began integrating bioimprinting with organ on chip, creating more functional and realistic model of the tissue and organs. Now let's talk about the mechanism of bioprinting. Bioprinting is basically 3D printing with living cells. Instead of plastic or ink, we use something like bioink. Bioink usually a hydrogel mixed with living cell, sometimes also combined with growth factor or biomaterials for structures. The printer then deposits this bioink layer by forming a layer of 3D structure, just like building a house bricks by brick. There are three main methods: extrusion based printing, which bioink is pushed out in the continuous strand, this good for large layered tissue structure. And the second one is droplet or inkjet based printing, where tiny droplets of cell laden ink are deposited in patterns. This gives very precise cell placement. And the third one, laser assisted printing, which uses light to move cells with extremely high resolution. The critical challenge here is maintaining cell viability, in other words, keeping them alive during and after printing. Success also depends on the resolution of the structure and the property of bioink. Now let's see how organ chip work. On the other hand, organ chip system are many miniaturized organ inside a chip. They are made from soft polymers, usually PDMS, and have tiny channels that allow fluids to flow, mimicking blood circulations. The channels are lined up with human organ specific cells. For example, if it's a lung on a chip, it might have a lung epithelial cell on one side and blood vessel cells on the other, separated by a porous membrane. This setup allows researchers to recreate conditions like breathing motion, nutrient exchange, human response, or even muscle contractions. What amazing is that sense can embed into a chip to monitor cell behavior in real time. So basically, with organ on chip, you can mimic how an organ behave inside the lab without using actual patients or animal. Let's see what are the current uses of bioimprinting on organ on chip. That is the application. Now let's look at some applications of these technologies. Drug development and toxicity testing. Traditional animal models are used, but they don't always predict how humans will respond. Organ on chip provides a more accurate human like model, helping pharmaceutical companies test drugs more safely and quickly. This is modeling. We can create models of cancer, cardiovascular disease, gut inflammation, kidney disorders, and more. For example, a tumor on a chip can mimic the tumor microenvironment, including oxygen level, supply, and human cell infiltration. Personalized medicine. With patient derived stem cell, we can actually build chips that represent a specific person organ. This means doctor could test with treatment work best for an individual before giving the drug. Regenerative medicine. Bioimprinting allows us to fabricate tissues like skin, bone, cartilage, or even blood vessels. One exciting example is bioimprinting skin graft for burning patients. Infection researches. During COVID 19, lungs on chip system were used to study how the virus infects cell and to test antiviral drugs. Multi organ system. Scientists were now connecting multiple organs together, for example, linking liver, pancreas, and intestine to study how drugs are metabolized across the whole system. Some exciting recent studies includes in 2023 lung on a chip model were used to study SARS-CoV-2 infections and drug response. In 2024, MIT researchers developed a tumor on a chip platform to study cancer immunotherapy. In 2025, scientists created a multi-organ chip mimicking the liver, pancreas, intestine axis to study metabolic disease like type 2 diabetes. Both bioprinting and organ on chip offer huge advantages. They are close to human they are closer to human physiology than traditional method. They reduce or replace animal testing, solving ethical concern. They allow real-time monitoring of biological process. They open the door to personalized medicines. They can support high throughput screening, meaning many drugs can be treated in parallel. But of course, challenges remain. The cost of equipment and expenditures is very high. Some cells or construction have a limited lifespan. They can't yet replicate the entire complexity of the human body like hormone influence. Scaling up from small chip to small functional organs is still hurdle. There are regulatory gaps. FDA and EMA are still validating this model for clinical use. Looking into the future, we are moving towards body on a chip where multiple organs are connected to stimulate the entire human system. 4D bioimprinting is emerging, which printed tissue can change shape or function over time in response to stimuli. Organoid plus chip are being controlled to improve accuracy. AI driven modeling is being integrated for data analysis and predictive simulations. NASA is exploring organ chip in space applications to understand how organs behave in microgravity. To conclude, bioprinting and organ on chip technologies represent a new era in biomedical science. They give us more accurate model, reduce our reliance on animal testing, and open the possibility of creating personalized therapies and even lab grown organ in the future. By 2030, this technology could completely transform how we approach drug discovery, disease treatment, and organ replacement. While challenges remain, the progress so far make it clear that we are on the path to future where medicine is more precise, more ethical, and far more effective. Thank you.